Hello, everyone. Welcome again to another edition of G.T.E Professional Network Podcast. Again, I'm your host, Ed Peterson. Today is Thursday, ladies and gentlemen. July the 2nd. Can you believe that? As we now continue our growth series for the month of July, as we now enter the third quarter of the year. And this is an opportunity, ladies and gentlemen, for us to really collapse timeframes and expand our businesses like never before. Every third quarter of every year, it's always going to be a quantum shift or leap thereof for us to grow our businesses, build our networks, and help in the communities that we serve in. As servant leaders, we're going to have that continuation of that regard. I have my special guest on today, Mr. Carl Scott Jr. We're going to be talking about ConnectMD, which I'm super excited about because I got involved with this company a week ago, actually, and I'm still going through the training of this. I really enjoy looking at it as I took the time to take copious notes and understand the foundation thereof of this particular program and how it's benefiting millions of people across the country in reference to this as well as around the world. And so with ConnectMD, it started back in 2019 under the vision of course, Mr. Jason Paget. And so when you look at opportunities, ladies and gentlemen, we always try to find something that's going to benefit you as well as your household, as well as everybody else across the country. So, Carl, I want to thank you for coming onto the show, brother. And just to give a little brief description of ConnectMD, I'm going to share this piece of it so people can kind of understand, hey, what is ConnectMD and what are you talking about here? So ConnectMD is a subscription-based non-insurance virtual healthcare service provider. It offers individuals, families, and businesses 24/7 nationwide access to telehealth solutions without requiring insurance, deductibles, or traditional visit copays. So that's basically what it is in a nutshell of what ConnectMD is. And Carl, since you've been involved in it, how has it been for you?
Man, it's been astronomical to say the least, Ed, because of the fact that the crisis is real when it comes to healthcare right now. You know, the cost is up, and most people know what's going on in the healthcare space when it comes to me saying it's a crisis. Some people would say that word is too light. There's a lot of people walking around who can't afford it. They can't get access. The affordability and the access are the two biggest points that people struggle with. So if we look at some of the stats right now, Ed, 8 out of 10 people are walking around needing prescription medication. They're on prescription medication, and they have a high need for it. There are 7 to 8 out of 10 people walking around with medical debt. So with those two pieces right there, that tells you, Ed, there's a high need for healthcare. Okay. 82% of the people that go in the ER are in there for non-catastrophic events. That's supposed to be redirected to your urgent care, to your virtual telehealth, which is a big solution for what's happening in the emergency room. And Ed, you and I both know we can have the best catastrophic insurance out here, correct? But once we step one foot in the ER, Ed, are we guaranteed primarily to get a medical bill that'll probably break your neck for the most part as we go in the ER?
Yeah, for sure.
The insurance does not pay for it. They don't pay for that. No. So, yes, you mentioned ConnectMD on the front. This is just a great solution for those that are listening to this podcast because you're talking about something that is 100% telehealth. You are able to get a doctor on the line, virtual or over the telephone, anywhere in the United States, including Puerto Rico, including Guam, and the outlying territories of the U.S. So wherever you are, 24/7, you can access a physician. They have over 17,000 board-certified physicians, Ed, and Connect has been around since 2019. They're servicing over 500,000 members nationwide. So well-founded, well-established. This is just a great access point for people that don't have coverage when it comes to healthcare. we service 3 groups. One being the person that has health insurance, Ed. This is an enhancement if you do have catastrophic health insurance.
Right.
So if it's Friday evening, Ed, you and I probably only have 3 choices. If it's Friday evening, your health insurance, if you have it, is already closed. You get strep throat. You can either go to the ER, urgent care, or hey, maybe we can suck it up and wait till Monday and hope to see our doctor, correct?
Correct.
Most people are going in. They go to the ER because they can't get the prescribed medication, so they go to the ER, and now you get that groundbreaking bill coming to you, right?
Right.
So from here, we can actually just use the telehealth here, get a physician on the phone. These physicians will assess your situation. Then they'll either prescribe medication or refer you to a specialist. Ed. Huge in that aspect. And when we talk about affordability, the plan also includes vision, dental, chiropractic, labs, and mental health. We go to 5.
Yeah.
These 5 are the only thing that you would go into a mortar and brick physician or facility to use. You get up to 60% off of those 5 services.
Wow.
Okay. This is not insurance.
Right.
This is a medical membership. So we have greater reach with the features that we can provide because it's not being insurance. So what's great on that is, Ed, we can put up.
Yeah.
Exactly. You can put up to 7 people on the plan at no extra cost. Now that's huge.
Yeah.
You're able to put up to 7 people on there, no extra cost to them, and they can use the plan anywhere across the United States. You also don't need, for my Haitian friends, Venezuela and Hispanic, you don't need a social security number to use this plan.
Wow.
So no social, no copays, no deductibles, and up to 7 people on the plan, age 25, all the way down to an infant can get on this service.
Okay. That's huge. You're right. That's very impactful. And as you said, those key services that you mentioned is critical and relevant for today. When you talk about the virtual urgent care, around-the-clock consultants for acute issues like the flu, strep throat, allergies, and UTIs. And then you got your virtual behavioral health, which I'm really excited about that. Unlimited access to licensed talk therapists for stress, anxiety, and depression. And then you got your virtual primary care, long-term care coordination, routine screenings, and preventative consultants. And then you got your virtual dermatology. I think the dermatology part I wasn't really aiming you had, but it has remote photo uploads for skin, hair, and nail diagnosis within 72 hours. And then, of course, you have the Connecting the RX for include access to over 1,000 common generic medications at no extra cost, plus prescription savings that you'll get as well with the program. So, brother, this is like a one-stop shop for your benefits, which you ain't got to go outside nowhere else to get.
Exactly, man. Virtual one-stop shop. And someone's asking a question, Ed, how much does it cost?
Exactly.
This is as low as $59 a month. $59 a month, all the way up to the highest plan, which is $149 a month. Hugely affordable in that aspect. And again, guys, up to 7 people, your family members, kids, or whatever, can be added to the plan at no extra cost. Age 25, all the way down to a toddler.
Okay.
So that's hugely affordable there.
Yeah, that's very affordable. And like you said, insurance right now is costly with the co-pays and all of the different restrictions they have. This right here benefits everybody across the board without all of the red tape. And so I'm really excited about this opportunity that we're able to share this today, ladies and gentlemen. And Carl also has a lot of people on with ConnectMD that he brought on board too as well. And if you want to, this is also a business opportunity as well for you to participate in with us sharing this. And this is just a win-win across the board. So, Carl,
Yes, indeed, Ed. So, I mean, yes, sir.
yeah. So with that, man, I'm really
I
excited.
think we
How do
got
you?
to.
Yeah. So what are you doing now? How are you getting the information out to the general public in reference to ConnectMD, and how you get them to plug in?
Excellent. So, hey guys, all you all have to do is reach us at a link that is in the chat, and I'm gonna let Ed kind of put that link in the chat as his very own, and that way, when you click on that link, it'll take you directly to the membership, so that you can actually go in and be able to get access to this great plan. I'm going to give you all the details as to what's available to you. And in that way, you can actually go right into the plan. And guys, look, there's no waiting for open enrollment. It's available to you right the minute you subscribe to the membership, you get instant access. So that's
Wow.
cool right there.
Yeah.
And I think Ed, the business name I think was The Handle. Is that correct?
Yeah. Yeah. Global Touch Enterprise. Yeah. Yeah. Global Touch Enterprise is the handle name
Excellent.
for that, and that's the connectmd.com / Global Touch Enterprise.
Yes, indeed.
Yeah, so you can
Yes,
go there.
indeed.
I'm gonna post this out, and again, I'm learning a lot just in a week's time as I've been studying this and knowing. Again, ladies and gentlemen, this is an opportunity for you to really get the correct information on how to get this into this program of ConnectMD and how it can benefit you and your family and also your business. If you're business owners out there, when you have a business and you got employees, this can also help you benefit them. So that way you don't have to worry about people getting sick or you losing time from employees taking time off to get well, get better. They can automatically get access to doctors right then and there, real time, and get the information that they need to do what they need to do. So this is again, this is a one-stop shop. I'm super excited. I'm elated about it. And I'm real happy that Carl had gave me some information more about it. And I wanted him on the podcast today to talk about that and what he's done. I mean, how long have you been in the program, Carl?
So, Ed, I own a life and annuity insurance agency for the past 3.5 years. We focused on IUL and annuities and whole life. But we picked up the healthcare membership on January 22nd of this year. We are now servicing in that short period of time over 260 memberships.
Wow.
Excuse me, close to 300 memberships at this point now. We're at about 290 memberships. So we have been servicing those memberships very well in the aspect. And also, I want to point out one other thing that's a huge benefit and what's unique with the telehealth program that you're hearing about today. We are very unique there. Telehealth is not new. It's been around, and there are some other telehealth programs out there, but most of them cap you at a certain amount of usage that you can use before you're charged. You also can only put a certain age group on those telehealth plans. And then thirdly, not all telehealth programs, the doctors are not able to prescribe medication. Now, I'm going to talk about that. Our doctors can subscribe medication. They're bilingual, and they can also prescribe medication that on our plans, at the minimum, 300 to 1,000 prescription medications for free. Anything outside the ConnectMD formulary there is up to 80% off. That's huge. And you heard me, Ed, in the beginning of this show talk about the stats. 7 to 8 out of 10 people on prescription medications. So guess what? Is there a huge need for this type of service? Yes or yes, sir?
Yes, it is. Yes, it is. And you're absolutely right, Carl. And again, this is real information, ladies and gentlemen. Again, you can go to my website and you can see everything there in reference to that. And this is going to give you an opportunity to really think about what you can do moving forward. So it doesn't have an age restriction on that, like most places do. This is age restriction free. So you can basically um, send this out to your family, again, friends, people that you know in your community, your neighborhood, that can basically also benefit from this. And what Carla said is really amazing because I had a chance to really dive into it myself on the agency level with ConnectMD and see exactly how they are implementing this and how are they able to do what they're able to do. That's a good question. And a lot of people ask that, So I'm going to send you guys more information in reference to that. And it's just turning this healthcare portal that you'll get online. And this is the cool thing about it. You can get it online. You can use your phone and do this, right, Carl?
That's exactly right. You can use your phone, you can get online and go to the site right there from your cell phone. You just click the link. And Ed, I put that link in the private chat. It would only allow me to go into the private chat. So maybe you can actually share the link
I'm
in
going to share it
the
right now.
public chat on here.
Yeah, I see
so that
it.
it goes.
Yeah, news streaming. Okay. Huh. Okay, so let me post it in there. HTTP. That way we can get that, and that is connect MD agency.com/global touch enterprise. And that's going to be the link there. Okay.
There we go. Yes,
right.
Sir.
So that's it, ladies and gentlemen. Again, Carl, you have really expanded this network in a short period of time since January, you say, of this year, all the way now. We just entered the month of July. Dude, that's only 6 months, man. and you already channeled up with over 300 members in here. And so how are they responding to this information of this program with ConnectMD?
Hey, astronomical, man. And all of that expansion couldn't happen with some great leaders. Some of those leaders that helped to grow some of the membership base within ConnectMD in such a short window of time. Omar Buchanan. We also have Vianney Connor and Edmundo Hernandez. Mr. Martell Matthews. A couple other leaders have taken on the arms to expand and grow the membership base to where it is, along with DeJaneira and Ceci, and done some really great jobs with adding members to the portfolio. So as you know, again, the higher the need there is for something out there, and if you can provide a solution, you start to really help the masses of people out there that are looking for healthcare coverage. And that's where we are right now today, Ed, is in a situation where people are needing some type of coverage. There's a lot of people walking around that have no healthcare coverage at all. And that's a lot of your entrepreneurs and solopreneurs don't have any coverage. And so this is a great aspect. So much so that, Ed, you don't know this, but if anyone does decide to pick a membership through your podcast channel, which your link is right there attached to it, they're going to get to choose a 4-night, 3-day hotel accommodation for 2 adults. They get to choose from several destinations. I know a couple of people have chose Las Vegas, Atlantic City, New York is on there, and even some local places. I live in Houston. I think Galveston is on there, San Antonio. Mm-hmm. But they get that just for becoming a member from seeing this on your show. And so when they enroll as a member, you just send us their contact. We definitely send that directly to them, and that's it. Keep it simple. I wanted to say that before we close out because I know we're almost about to hit 20 minutes.
I
wanted to make sure I got that in.
Yeah, you did. Thank you, brother, and appreciate that. And definitely, that's good information too as well. So, guys, to sign up, you get a benefit for just signing up with ConnectMD. Again, you can just go to my link, and that'll get you started. And like I said, I'm going to be showcasing this continuously throughout the social network, and as well as on my website too as well. And when you guys get a chance to we want to learn more about it, of course, you can connect with me. And then, of course, we have my brother Carl, because I actually got in with him because of what I know how serious he is about helping people. And that's what it's really all about, using, I call the PHP effect, people helping people. The more people you help get what they want, you're automatically going to get what you want. But this program is really going to be a game changer for everybody that's out here that's struggling with healthcare costs and all these different levels here, and some that can't even get insurance because they don't qualify. So now you have something that automatically qualifies you that you don't have to worry about. That's the cool part about that. So no matter your age limit now, and again, family members, you can set your whole family up on one plan, as Carl mentioned earlier. And so this is one of the reasons why I'm bringing on everybody to share their story, talk about what they're doing in their businesses across the country, as well as around the world, so we can make sure that we're all reaching out to each other and helping each other in the communities that we serve in. So, Carl, thank you, man. I really appreciate you sharing this opportunity with ConnectMD. We're going to talk more about it and more in depth into with ConnectMD, and starting getting businesses signed up and how business owners can really benefit from getting ConnectMD implemented into their organizations, as well as churches and nonprofits too, as well, since that's also I serve in that arena, to get them plugged in with ConnectMD. So we're going to be working closely together while we plug in that in the group, and then I'll have about as much as you have in yours, 300 plus. So I'm looking forward to that as we continue to shine.
Outstanding, man. My pleasure of being on the show with you, and I look forward to doing the business to business, showing you why those businesses can benefit hugely from the ConnectMD membership as well. We definitely have a big part in the role with the businesses to provide their employees a benefit that the employers are happy with, man, Ed, because the employees stick and stay because of the benefit they receive. And so, be happy to talk about that on your show coming up.
Yes, sir. All right, ladies and gentlemen. So you heard it best from us. This is my show for today. I'm really super excited. I was going to shut it down at 3. That's where I'm at, the time limit. So my time limit is up on that. But I want you guys to really check it out and go to our website, connectmdagency.com, and it's going to be /Global Touch Enterprise. And then, of course, I'm going to have you to talk about it even further, like I said, ladies and gentlemen, so we can give you some more information. And again, this is going to help you to benefit you in the community where you serve. And then we share this. The more we focus here, ladies and gentlemen, the stronger we get, the better we come out. And guess what? We're all winners at the end of the day. So I want to thank you all for this opportunity to share. Every Tuesday and Thursday, ladies and gentlemen, I'm always on this podcast at 2 p.m. Central Standard Time. We're going to be talking about and have special guests on the show all this week with my insurance agents. I got realtors. I got medical people. I got just about everybody industry-wise. I got lawyers. I got judges. So we can all talk about some things that's really going to be impactful for your growth, for your opportunity to share, and how you can actually work in the communities that you're serving in more closely. So that's going to be another piece with Dr. Little and everybody else that we got on board with Graduates Gift. And then we'll be working with down in Friars Point, Mississippi with Mr. Brown when he's redeveloping that whole town of Friars Point, Mississippi with MBJ Construction down there in Mississippi. So all these things that we're doing, ladies and gentlemen, is going to benefit everybody. It's all about the know-how and how we can connect and how we can participate. So with that, thank you, Brother Carl, for being on the show, brother. I look forward to talking with you some more, my man. And we're going to get this thing done and knocked out the right way. For sure. So with that, y'all take care.
That work, man. Yes, indeed.
And y'all keep building the dream and keep the faith. So y'all take care now. Peace out.
Nicer than anything you have at home.
Thank you.
Yeah, bye-bye.